Metaphors are an effective way to help someone easily understand complex ideas you're trying to get across, as well as then relate to what you are suggesting. Today, I'm going to go through 3 metaphors that you can use with most patients that you see, and they can be used for any speciality. Welcome back to Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills facilitator here in the UK. Today, we are talking about metaphors. As I just said, we're going to go through 3 examples that I use day to day that you can use with most people that you see, regardless of whatever speciality you're in, because it will cover many bases. Before we do that, we're going to go through why metaphors are so important. Metaphors aren't just used effectively for healthcare or medicine, they are used across society to help us easily understand complex ideas. Whether it's in advertising, or in sales and marketing, whatever it is, metaphors are used daily, whether you identify them or not. In healthcare, we can use metaphors to help patients better understand diagnoses or treatment options or prognosis. Across the board, they can be really useful because they help make complex ideas simple. And that is providing that whatever your metaphor you're going to use, the patient can relate to it. There's no point using a metaphor if the patient either doesn't understand or doesn't know what you mean. It will just fall flat. There are tons of metaphors out there. We're not going to go through them all, obviously, because there's millions. And you will have specific ones that you will use in your specific area. The ones we're going to go through today, you can use pretty much across any speciality because they're quite general. I'm not going to claim to be the creator of them. They may have been used long before I started using them, but certainly I don't own them, and you are welcome to use them as much as you please. If you start using these in practice after you've listened or watched this, do let me know how it goes. I'm at BYBrow Physio on whatever social media you're on, and do subscribe to this for more. So this first metaphor will be for situations where someone's been perhaps have an injury or a surgery or something that's just knocked them off kilter and altered their function of how they normally do something. So a simple example from my world, let's say someone's had an ankle sprain, right? Given a bit of time, swelling starting to come down, they've been referred back for their rehab. And their classic line is, I thought I'd be stronger by now. I thought I'd have more flexibility. Well, I thought I'd be able to do more on it by now. But this scenario doesn't just have to be for physical rehab. It can be applied to neurological, gastroenterological, cardiology, whatever, where the body's needing a bit of a push to get back to where it was before, whether that's with strength, flexibility, balance, whatever it is. And so the classic metaphor and line I will often use is to say to the patient, well, you're right, but the body doesn't reset itself to default automatically. Now, what am I implying with this? Well, most people by now have used a computer or an electronic device, okay? And they will probably be aware of the term reset to default. We know, you listening to this or watching this knows that the body doesn't always do that. Doesn't just automatically reset itself to its previous strength, balance, flexibility, whatever it is, function after some significant change or injury, okay? It needs to be helped and encouraged back there. It won't just always do it on its own. So the reset to default analogy or metaphor is an easy way for the patient to hopefully relate to this because most, as I say, will have used a computer. They'll be used to that term. Yes, there'll be the 5%, there's tiny few amount of people who, I'm talking significantly older generation or very young generation who can't quite relate to it, and you may need to think of something different. But 95% plus will understand about a default setting and be able to relate to that. So it's just a very easy way to help someone understand, oh, my body doesn't do that automatically. I need to encourage it to get there. And then through whatever means you are treating them for, whatever you're going to suggest, you can then help them realize why that's important. So that's the first metaphor that you can steal, the body not resetting itself to default. Very simple, one sentence really. Next one's a bit more complex, so we're going to up it a bit. And this is for situations where someone's having medical imaging, be it scans, x-rays, ultrasounds, what have you, okay? And in your diagnosis, you're realizing that the imaging is okay, but the underlying reason for their problems may be something that imaging can't see, okay? Maybe something to do with how things function or connect in the body. But the classic example from my world would be someone having back pain, it's been going on for a while. They get their scan looks fine, and they say, well, I'm still in pain. Why is that? Why is the scan not picked this up? Now, there'll be lots of complex bits behind this, but the question of why has the scan not picked that up? Why is nothing shown up on the imaging? Again, you can use this with the back pain, but it can be applied across medicine, across healthcare, for whatever speciality you're in. And the analogy I'm going to use, this time you can use a prop. Most of you, I assume, will have your phone on you when you're sitting talking to the patient, or a phone nearby. And I will say, well, imaging doesn't always show us the problem, okay? So you've got your normal imaging here, but clearly you're still having symptoms, still struggling with pain. But can I explain how this works in a simple way? Hopefully say yes. Pull my phone out of my pocket. I will show them what you see here. I show them my phone. And I say, can you see my phone? They say, yes. Does it look intact? Yes, like your imaging. Okay, nothing's broken, torn, ripped, whatever. Can you see the Wi-Fi signal or the connection? And they'll say, no. Okay, you could have an intact phone, right? But it may be useless if you don't have the Wi-Fi or the signal to actually make a call or send a text or whatever you want to do with it. It's the same thing with the body, right? Imaging will show us structure, maybe how things are together, but it won't show us how those things function, whether that's, again, strength, flexibility, connections, excitedness, whatever it is, okay? Whatever your field is. So it's a simple metaphor. Again, 99% of people in the world now, in especially Western developing countries, will have a mobile phone. They'll know what you mean by Wi-Fi signal or connection, okay? Again, they'll be able to relate to it. And it's an easy way for most people to understand that their imaging may not always show all the problems. Okay, so that answers the question of why is my imaging normal, but there's still a problem. And then from that, you then will explain whatever's going on, your reasoning as to why they're still in their situation. So the final analogy we can use will involve some drawing. Now I'm going to talk you through it. If you're watching this, I'll try and do some images to go with this. If you're listening along, I'll put some pictures up on social media. But this one involves some drawing, okay? Patients aren't always auditory learners. Sometimes they're visual. Like I had the prop with the phone last time, okay? They can see the phone, okay? And they have the concept of the signal and the Wi-Fi from what you see on your phone screen, okay? This involves a little bit of simple drawing, nothing particularly complex. That, again, may help more visual learners compared to auditory ones. The cocktail analogy is very useful for when you're trying to demonstrate or explain how multiple factors is influencing someone's condition. We know now that across many long-term healthcare conditions, there often isn't one cause. It's often multifactorial, or biopsychosocial is the fancy word to use, where it's not just inside their body, but it's people around them, their environment, psychological factors as well, past experience, all sorts of things, okay? And so the cocktail analogy is an easy way to kind of paint this out for someone in a way that they can easily relate to. 95%, I'd say, or almost all of the patients you'll see will be aware of what a cocktail is. I'm talking about the drink, to be clear. But you can ask them if they don't drink or don't like cocktails, about if they have a hot drink they like coffee or tea, or something that has different ingredients, because again, they'll be able to relate to it. So again, let's use an example from my world. Let's take that back pain person we were talking about earlier, who's had the normal imaging in theory. There's nothing structurally off for their age compared to normal. We've been through that phone analogy, and then they say, well, why am I on all this pain? What are all these factors involved that you keep talking about? So here's how I would lay it out. You can follow along at home if you want to, and I'll talk you through what I say to them, and I might interject with little comments as I go. So the first thing with the cocktail analogy you're going to ask is, what's your favourite cocktail? And hopefully they'll say something you've heard of. They may say, I don't drink. And as I said before, you can say, well, what is your favourite drink? And they'll say, I know, tea, coffee, something else. Okay, and you can still use that exactly the same. The cocktail just helps because it involves a combination of different things. So it helps give a more visual idea already. So they'll tell you whatever their favorite cocktail is. Let's keep it simple for this. Let's say they say a gin and tonic, G&T, which is literally 2 ingredients of gin and tonic water. So you draw out your little cocktail glass and then put the comments of gin and tonic and an arrow going into it. Now what I do at this point is I'll put next to gin, let's call it work, and let's put next to the tonic sleep. Okay, 2 lifestyle factors that could be involved. So to add extra little visual or really get them involved in this, I'll try to paint the picture for them as well. So I say, here's your cocktail. If I could give you anywhere in the world to go and drink your cocktail, where would you go? And then they'll say wherever they want to go and have that cocktail. Very personal to them. Again, this is keeping it very specific to them. It's their favorite drink, it's their favorite location. So it's very personable, easier for them to relate to and go along with and enjoy, hopefully. Let's give it an exotic place. Let's call it the Bahamas. Okay. So the person says in Bahamas, you say, great. So my next line is, imagine you're in the Bahamas. The waiter's just turned up. They put that G&T in front of you. But just before they do, I'll turn up and I'll put in some salt, some sambuca, and some lemonade. How's that going to taste? And they'll probably say, horrible, or I don't know, not nice. I wouldn't want to drink it, something like that. And I might follow up with, yeah, it may even harm you, okay? Because I've added in these extra elements here. These are what we'll call additional factors that in their life that may be influencing on that condition, okay? So next to those things, I'll then write reduced activity, mental health factors, poor sleep, okay? Whatever it is, okay? Whatever those factors that they've said in their story that you've identified as being involved in driving that long-term condition, okay, that you want to give them an idea about how it's multifactorial, it's not just one thing. You're using those specific things they've said, so again, it's personal to them. And then in turn, you put those in next to the added ingredients you've added, and then I would then say, in turn, these things will also influence that work you're talking about, and the sleep or the relationships you mentioned as well. And then they're affecting you can't, and then you're painting their story back to them. Demonstrate, but with the idea of the cocktail is that how it's this combination of all these factors coming together that's influencing on them. And most people are able to understand it because most people have either had or know what a cocktail is. And because it's a mixing of different factors, it adds to the multifactorial combination that you're trying to get across, but in much less complex terms. There we go. We've got the body not resetting itself to default. We've got the phone analogy. We've got the cocktail analogy. All 3 can be used with most people that you see across whatever speciality you are in. People should be able to easily relate to them and understand what you are trying to suggest for those specific examples. If you want to let me know about other useful metaphors, then do let me know on social media at BYBrowPhysio. Send me a message. I might even read it out on here. I'm going to start getting guests soon. So if you have guest suggestions, topics to cover, or any comments you have about what would make this better, do let me know as well. Thank you for watching it always. Do please share it out as much as you like. And I look forward to hearing from you and speaking to you next time.